Hello, Isabelle. So I will start by a question. It's a very easy question, but also very complex question. Does cancer have a smell? Yes, today we can say that this is yes. We don't really know whether all the cancers have different smells. Nevertheless, we know that cancer has a smell. So now I would like to know a little bit more about this, and I believe that people in our audience are of the same point of view. So can you please share with us the story of KDOGs? How did this project start? How was it conceived? Because we're in this project using dogs in order to detect cancer. Well, KDOG are dogs, but also chemistry. These are two projects, and these projects basically have babies now, but the genesis is that I'm a nurse, and I'm working on wounds, especially wounds related to cancer, because sometimes cancer is not inside, but showing up on the outside. So we have a lot of different cases that can happen like that, and we don't always know how to treat it. So for me, as a nurse, it was a problem, the smell of these wounds, because this is something that is very disturbing for the patient. So I did this thesis where I was comparing microbiology, clinical studies, and I also analyzed all of this in order to try and find the solutions against the smell. So I was working with all of this because the smell is basically composed of a lot of different molecules. So this is organic chemistry, and it was a game between relying bacteria and volatile components. And I wasn't able to relate all of the volatile components to bacteria or to some other smells that are emitted by the body, because the body emits a lot of different smells. So the hypothesis at the end of my thesis was the following, that probably these volatile components were emitted by the tumor itself. So whenever we are talking about this type of hypothesis and we are finishing our thesis, we actually have to either stay aside or just to go and look at this problematic. And I started working with a lot of people who are working with dogs, training dogs to detect something, and they're also working in analytics of chemistry. And so we actually decided that it was interesting to use dogs, because today some dogs, not all of them, have this exceptional sense of smell and the capacity of detecting smells, which is why we decided to organize a very easy exercise, meaning taking some sweat of a woman who has no cancer and some sweat from a woman who has cancer, and to train the dog to recognize these two groups of patients. And then we did the proof, the evidence of the concept. So we actually had these dogs, and in a random way, we put them in contact with people who were diseased and people who were sane. So we actually were always having 1 positive and 3 negative results. So you always know whenever we're working in diagnosis is a very complicated situation. Nevertheless, this very first stage was very successful for dogs. They were able to basically detect the positive cases of tumor in the sweat, and they were able to do it in more than 90% of cases. So we actually found out that this was something that was specific to the cancer, this smell. So whenever we are looking at the other means of doing this investigation, it actually was confirmed, the results that were detected by the dogs. I would like to say, yes, in analytical chemistry, this is absolutely fabulous, but it's complicated when we're talking about the human smell, because we have the tumor, but we also have the smell of the tissues, your secondary smells, and so on. We all have had these experiences. When you're eating a very spicy dish, you will basically smell this spice in the sweat. So you have all of these components that are part of the sweat, which is why it's very complicated to find the signature, a complex signature of the tumor. So we are looking for it in order to find out that will be this breast cancer, let's say, or something like that. But what we know is that there is the smell, and dogs are able to find this smell. Well, of course, it's not always the case at 100%, because a dog is also a living being, and sometimes they will be tired or something. So for them, it's probably not really a very important state. They don't really care. They're playing this game, and this is it. And for them, what is motivating is the incentive, the compensation that they will receive. So this is the positive the positive stimulation for them. So what they are looking for, the dogs, I mean, is this compensation. From the point of view of the scientific approach. What could you talk to us about the protocol that you're putting together in order to validate scientifically the data that you're getting? Well, we actually did something very classical. Right after we have had the evidence of the concept, we did this study at the clinical of the clinical aspect. And when we started this clinical study, we actually are based on experience that already exists in drugs, explosive, and so on, but we have a very little scientific data about the materials, the smells of which we are getting. We also have very little experience about the training of dogs. So which is why we started our clinical study, but we decided to be really careful because we decided that probably it will not happen as we wish for it to happen. This was one of the clinical studies, just as most of them. Well, right now we actually stopped it because the results were good, but not very satisfactory for the detection of cancer. Nevertheless, we really quickly noticed variability of dogs, which is also related to the difficulty of the exercise that we are asking them constantly to do. And also we had to stop our study during the COVID and to keep some of the samples for a certain time. But whether this sample could maintain the smell, well, we don't have any information, any scientific information about that. But even before stopping clinical studies, we organized some other studies that we were missing for selecting dogs, but also for the materials that can better absorb the smells and also give out the smells. And we did it with the partners from the Strasbourg University. We did it from the point of view of the materials. We also worked with the Criminal Research Institute from the National Police Department and Gendarme Department. And why was it important for them? Because they are using this technique a lot for their criminal goals, working to identify criminals. And this is like the whole program about conservation, but also understanding of dogs, because we're always saying dogs are great tools of diagnosis. But I can tell you that all of them don't have the same skills and capacities, I would say, and the same ways of work. And of course, men that have selected them will try and say that this is a great dog in order to do the detection and so on. But this is a very difficult work, and we also have a lot of dogs that will be trained for 2 to 3 months and they cannot do it. So we have to restart the training, and this will be really, really complicated. So in order to better understand how a dog works and how can we select the right dog, this will be very useful for all the professionals who are working with dogs. Dogs that are doing assistance or dogs that are detecting something to assure the safety of the territory and so on. So you can see within a couple of months we will also start the process of using electrodes, putting them on the heads of the dogs and to see how it actually works and try to understand all of this and try to use all of these parameters in the selection of the dogs, because for us it's very important to understand to what extent dogs can do it and up to what point we can move forward with all of this. So for us, this is still like a pilot project, but we're also continuing analytical chemistry work. We still have some time, so I would like also to ask you, because this is all fascinating, how do you see, Isabelle, the dissemination of this type of technique beyond our borders, beyond our country, so that to be able to amplify the screening of some of the cancers for the future? KDOG will become a pretext, because the motivation behind it was to understand how we can find and diagnose population so that to grant treatment later on. So this is still our motivation. But in order to detect blood cancer, we have to use electronic means. And here I would like to say that I will just entrust this to someone else, because I'm not interested in this type of work. Nevertheless, this is a very interesting hypothesis and a very interesting point for the research that I believe that northern countries will be interested in. For the research, I believe that we will be able to do something probably less variable, but something very good that will allow us to do this screening, massive screening, that will allow us later on to proceed to the more clear and precise diagnosis. This will be a very interesting trajectory. Yes, of course, we're not there yet, but this is a great work that is being announced. Thank you very much, Isabelle.